In 112 countries all over the world, for more than 1 million people, kidney failure leads inevitably to death. In many low and middle-income countries where dialysis is available, the expensive dialysis treatment is more than most families can manage. By the circumstances of their birth and their income, 1 million human beings die each year. Mothers and fathers, children, brothers and sisters taken from their families and communities, even though life-saving treatment is out there, even though dialysis or a kidney transplant could save them. Bridge of Life is changing this reality. Bridge of Life DaVita Medical Missions is an independent nonprofit that brings dialysis to countries where access to this life-saving treatment is non-existent or limited to the wealthiest people. We establish self-sustaining clinics by training local caregivers and providing equipment to our in-country partners. And then we provide follow-up support. These clinics can save lives for many years to come. Bridge of Life relies on both corporate and individual supporters and volunteers to do our life-saving work. Our beginnings in 2005 were rooted in the passion and strength of DaVita dialysis teammates.
Well, way back in 2005, 2006, DaVita, which had already called itself the DaVita Village, a community first and a company second, we had a lot of conversations with our teammates, asking them in what other ways we could express this fact that we're a community before we're a company. One of the most stated desires of our people in terms of us doing more good for the world was to take kidney care overseas to places where prior to that people just died. And so we founded Bridge of Life DaVita Medical Missions. Within a year or two they became independent, but the DaVita Village continues to support them in all sorts of ways. We love the fact that they bring a company-like intensity to it, where the real emphasis on making sure every dollar gets spent well.
We are dedicated to providing life-saving treatment to people with chronic kidney disease who today have few, if any, options available to them. Ultimately, our goal is to expand access to dialysis so that everyone in need of treatment can live a healthy and productive life.
To date, Bridge of Life teams have completed dozens of medical missions in countries all around the world. Countries like Mexico, Guatemala, Jamaica, Ecuador, Peru, Cameroon, South Africa, Tanzania, Kenya, India, and the Philippines. Bridge of Life medical mission teams have trained over 400 kidney care professionals, including doctors, nurses, patient care, and biomedical technicians. With the support of caring individuals and organizations, Bridge of Life helps in-country clinics provide an estimated 128,000 treatments to nearly 1,200 dialysis patients each year. Swayvon Williams was 19 when he was diagnosed with kidney failure. Because most of the public dialysis clinics in Jamaica are filled to capacity, he and his family sought treatment at an expensive private hospital. In just 6 months, Swayvon's mother had spent her life savings earned as a hotel housekeeper to keep her only child alive and had no realistic option to continue treatment. At the Williams family's darkest time, Bridge of Life installed 20 dialysis machines in 3 public hospitals, greatly increasing their capacity to provide treatment. Swayvon is now receiving life-saving dialysis treatments at no cost to his family. Bridge of Life's mission is nothing less than saving lives and changing the world. And there are many ways you can join us, bringing life and hope to people all over the world. One way is to become a volunteer. Medical missions volunteers travel to other countries to help us establish new or expand existing clinics or provide training to clinical staff. Support volunteers help Bridge of Life with ongoing operational needs, like database management and event support. You can also make profound impact through a financial or in-kind donation to Bridge of Life. Any amount can make a tremendous difference for those in need of dialysis in underserved communities. Just $50 covers a week's treatment for patients like Swayvon.
It starts at home, So every person has the potential to make a difference, whether it's raising money, whether it's giving of your time. Just step out of the box and be a part of something great. It's awesome.
You have the ability to give someone a second chance at life. You can make a difference.
These patients that, whose lives we're going to save, with the Bridge of Life, these are people's parents, they're their children, brothers, sisters. This is a very serious mission, and that's why it's, really rewarding for all of us to be involved with.
This is really about what treatment makes possible for people, which is the chance to live, the chance to work, the chance to enjoy their families and achieve the dreams that any of us have for our lives.
Each day, thousands of people around the world have a second chance at life because of Bridge of Life. But there's still so much more we can do. If you share our vision, we need your help. Together, we can change the world.